Star knots. Do you have any questions? All are clear? Because it's already in your group discussion task, right? Okay, all are clear? I just skip. If you said it's clear. Okay. Is there any question for this? Two regions of the oral cavity. Vestibulum oris and cavum oris proprium. Proprium in English means proper. Means that's the true cavum oris or oral cavity. Okay. How do these two regions are separated? Anyone? Why do we know that there are two regions of oral cavity? How do we know? What is the border? Yes? Anyone? I ask you. Anyone from the class? Yes, lady?
The dental arches.
Yes, that's correct. Dental arches with their supporting tissues. Not just the dentition, but also with the gum and the alveolar bone. Okay? Yes?
I'd like to ask, yesterday at the discussion, the president mentioned that we should add isthmus falcium as a part of the regions of the oral cavity.
Yes, that's the border.
Oh, so is it a part of the regions like the cavum oris, proprium, and vestibulum oris, or is it?
No. Do you know where the position of the isthmus falcium?
Yes, it's to the very same area.
So, do you think it's part of vestibulum oris?
No, but I just wanted to ask since the president mentioned that we should add.
Yes, it is part of cavum oris, but not the vestibulum oris. Is the part and the posterior border. Do you know what's the meaning of border? Yes? Is there anyone confused? What's the meaning of border in anatomy? What is the border of this room? The walls and the door. So it's the same. There is no special meaning in this case. The border means the thing that marks the position and the scope of that particular area. Is that clear? So there are superior, inferior, posterior, anterior, and lateral borders. Is there any question about that? And actually, you can mention it by yourself because you can see your own mouth. Am I right? Use mirror, of course. You cannot see without mirror, of course. Or you can see your friend's mouth. Okay? Just ask for the favor to open the mouth for a while for you. Try to occlude the two dental arch. Then open the lips. So what will you see in that condition? What will you see? If we only open the lips, but we occlude, do you know the meaning of occlusion? Yes. When you bite the upper, you make the upper and the lower dentition meet each other. That means occlusion. Can you do that? Can you occlude your own upper and lower teeth, but open your lips? Can you do that? So what will you see in such position? The vestibulum or the oral cavity proprium? Vestibulum oris. Is that clear? So does vestibulum oris have borders? Does it have borders? Yes. What are the borders? Superiorly? You can imagine it, right? Do you brush your teeth every day? Did you do it in front of a mirror or without mirror? use mirror when you brush your teeth? Yes. So can you see what is the upper border of the vestibulum oris? Those on the back, do you listen to me? So, can you answer? What do you see when you brush your teeth and occlude the dentition? What is the upper border of vestibulum oris? Yes? Maybe what?
Gum.
Huh?
Gum.
No. Have you done your group discussion? Yes, Harry?
Lips.
That's anterior. And lateral. It's anterior. Lateral. What is the border? Cheeks. Right. Anterior is the lips. Posterior. What is the posterior border of the vestibulum oris? Our teeth. Right. The dentition. All the dental arches, upper and lower, with the supporting tissue. Do you know what is the supporting tissue of the dentition? Do you know? Not yet? Why? You did answer. Do you know or not what is the supporting tissues? And? Correct. Not only gum. Gum is one of the supporting tissues. Periodontal ligament, gum, what else? Alveolar bone. Can we see all of them in our mouth? No. What can we see only? The gum, the gingiva. Okay? But do you think the gingiva will have a shape without the bone? No. Because the gingiva attached to the bone. It attached to the bone and it protects the bone. It covers the bone, so it attached to the bone and it protects the bone and the other beneath structures. Is that clear? So we can only see the gingiva as the outermost periodontal tissue. Okay? Is anyone confused? If you're still confused, please say so. Don't stay still. Did I ask too much? If I want you to answer, is it too much for you? Yes? You prefer not to say anything? I don't like to speak by myself in front of the class. If I like to speak by myself, I will go to the toilet. Don't you? Because I'm talking to you all. Not only to one or two or three students. Okay? So please give me the expression whether you understand or not yet. I don't say not because you have to understand in time. Maybe a student has their own pace. It's okay. But let me know whenever you haven't understood any particular topic. Is that too hard for you? Okay. So, is it clear? So what is the superior? Do you know what superior is? What is it? Upper. What is the superior border of the vestibulum oris? The green area. You may look at the pictures. You don't have to memorize it. This is not exam. This is clarification class. So make sure everything is clear. What makes you confused? You know superior means upper. What is the most upper part of the vestibulum oris? You can see the green area because that is the vestibulum oris. The green area. So what do you think? What is the border at the most upper and at the most lower? It will be the same. What is it? Specifically, what's the name? Because gingiva is all, that green area is also gingiva, right? How can you tell which part of gingiva is the border Upper and lower. Alveolar bone, we cannot see that. Frenulum is only 3 sides. Labial is only on the front, buccal is only on the side, right side and left side, upper and lower. So the whole thing has the border, right? Yes? Alveolar mucosa is not correct. All the green part is the alveolar mucosa. So what did you discuss in the group discussion session? Yes? Vestibulum oris. Please. Is it clear for you which area is the vestibulum oris? I just told you that it's the green area. It will be clear if the position of the upper and the lower dentition are occluding one to another. In this picture, the position is open, but they make it different by giving the color. So the pink or red color is not the vestibulum. Only the green area is the vestibulum. Is that clear? Okay. So what makes it hard for you to imagine which part is the... Can you say it by your own words? It's okay. Your own sentence to describe your imagination. What would be the upper and or the lower border of this vestibulum oris? Not gingiva, it is part of gingiva, but if we say gingiva, that means the whole green area is gingiva, right? The whole green area is the alveolar bone that is covered by the gingiva. And what we can see clinically is only the gingiva because we cannot see the alveolar bone. So if you say gingiva, it's not precise because gingiva is very broad. All alveolar bone area is covered by the gingiva. But which part of gingiva that makes the border of this vestibulum oris region? You don't need to remember what maybe you have read on the textbook, but I think you haven't read the textbook because there is no clue on your face, yes? And the junction should be 2 at least. Muco. Yes. Can you show on your own face? Yes, or do you have the picture?
Yeah, it's, I put it on my PowerPoint. It's here. Because you will see that it's like below. Correct. It's on the fading of the gingiva and also
So it's the junction between.
it's between the sides.
For the anterior area, for example, it is the border or the junction between the gingiva and, for the anterior, can you say it? Between the gingiva and the, for anterior? Yes?
It's between the gingiva and the alveolar mucosa here.
Which alveolar mucosa? Alveolar mucosa is gingiva, right? So, it is between gingiva and alveolar mucosa, it's the same thing. Frenulum is only at 1, 2, 3 particular sites, while the border is along the area. Don't you agree?
Is it the fornix?
Almost. But if I ask you back, do you understand what's the difference between fornix and the border of the vestibulum oris? Do you understand? What is it? No? If you don't understand, just say it. Don't just quiet. It takes time. We're waiting for you that doesn't have intention to answer. So if you know, say. Doesn't matter if it's wrong. If you don't know, just say it. Then I let you know. You know or not? No. So it's quick, right? Don't make me waiting for no intention to answer. Unless you are trying to answer. Okay? So the phonics is a space in between the attached gingiva and the anterior and lateral border of vestibulum oris. Now, do you know what is the anterior border of the vestibulum oris? I think I asked you this and you have answered. The lips. What is the lateral border of vestibulum oris?
The cheeks.
Cheek. So the fornix is the space in between the lips, the cheeks, and the attached gingiva. Can you get it? Can you follow? Now I ask you, do you know which one is the attached gingiva? Which part of gingiva that is attached gingiva? The one above? Anterior only?
If it's the upper teeth, then it's the superior part of the.
Okay, so it's almost right. Can you differentiate between the free or unattached gingiva and the attached gingiva? Do you understand? What is the difference? So, in which part of the gingiva it is? The free gingiva. Around each tooth. How far? It's correct. Can you make it more specific? How far? Around the teeth, but in which part and how far? What is the border between the free and the attached gingiva? You may use your own words, doesn't matter. Doesn't have to be the same as the reference. We exercising to make explanation sentence, description sentence. Yes? Anyone? Want to try? Which part is the free gingiva and which part is the attached gingiva? The part that form the upper and the lower border of vestibulum oris, are they the attached or the free? The attached. So it's correct. So you can use or make your own words to describe. Because there is no door between the free and the attached gingiva, right? So it just seems like one continuous tissue. Although actually there is a difference. As reflected by the name, the free means it can be moved, not attached. So it has two names, free or unattached gingiva. It's the same thing. We can say free gingiva or unattached gingiva. So as it is reflected by the name, it's clear, right? It's a part of gingiva that is free or not attached to the underlying tissue, which is the alveolar bone. Vice versa, conversely, the attached gingiva is part of the gingiva that is attached to the gingiva. So the name is very clear. It shows you what they are. Can you follow? So can you imagine which part of the whole gingiva is free and which part is attached? Yes? Which part? For the upper teeth. Yes. How about for the lower teeth? Can you make a sentence to be general? That can be applied for both the upper and the lower. The part of gingiva that is present using her answer before okay, which runs at the cervical region of the teeth. Have you ever exposed to this terminology, cervical? The neck of the teeth. Cervix means neck. Neck means a part of an organ that is narrowing. Maybe you are more familiar with cervix uterus. Would you? Cervix uterus, the place where we put IUD. Okay? The KB device. So I think he is not present, so it's okay if I talk in Bahasa, right? Only one overseas student? From Korea? Jeju? Not Jaehyun? I like Jaehyun. NCT. Maybe you like the younger one. Dreams or 17 or I don't know what is the younger group. Jeju, is it your name? Jeju? Please correct me if I pronounce it wrong. Jeju, can you follow? How good is your Bahasa Indonesia?
It's not like it.
It's not good, okay. Next semester should be better, okay? Have chat with your classmates in Bahasa, okay? Okay, so neck means a part of an organ that is narrowing. So as an example, I'm sure you are more familiar with cervix uterus rather than to the cervix of tooth. That it has the same meaning. Our cervix, our neck. Does any of you have a bigger neck than the head? Bigger neck than the body? No. So that's the clear example, right? The neck is part where it is narrowing, like our neck. Okay? So the other Latin Greek terminology is cervix, cervical. To give you a clear understanding about the tooth, because tooth has crown, has root, and between the crown and the root is the narrowing part. So it is also called as cervix of tooth. So again, back to the previous discussion, pregingiva is part of the gingiva that is present at the cervix area of the teeth. And it's free. It's not attached. So that's why sometimes when we chew some very small bolus, after we chew, can insert in that area, especially at the interdental pregingiva. Have you experienced that? If the remains of meat or anything cannot go by itself, we have to help clean them by our tongue. So more often it's at the interdental or interproximal area, and it can go inside the pregingiva at the proximal area. Okay? Because it's free, it's not attached. There is a space actually between the gingiva and the root. But it's only very thin area. You may check the internet or the atlas, whatever is more convenient for you to see clearer where is the border between the free and the attached gingiva. So the attached gingiva is the remains part after the free gingiva. That means the part of gingiva that cover most of the root. That's my own sentence. Maybe in the reference not like that, the sentence, but the description is like that. Okay? Why it is called as attached? Because it is attached to the beneath alveolar bone. Okay? In healthy tissue, of course. We are learning anatomy, as I said several times. Anatomy is learning the normal condition first. You are not starting to learn about any pathological condition. Because you need to know the normal condition first. Okay, so later you can compare. When there is changes, then you can say, oh, it is not normal. So now can you describe better what is the border of the vestibulum oris using your own words? Using a sentence that is applicable for both the upper and the lower vestibulum oris. What is the border? The junction using what's your name?
Gandes.
Ganesh.
Gandes.
Oh, Gandes. Because my son is Ganesh. Gandes, okay. It's a female name, Gandes. Okay, using Gandes' previous explanation, it's a junction, okay? You use that terminology, it's correct. It's the junction between what and what?
Between,
Yes?
tadi, before I said the mucogingival junction, so it's the junction between the gingiva and the bronchus and what is jadi kalau there are two types of gingiva, the attached and the unattached. So the attached it's basically like it's those are attached to the alveolar bone. So it covers like the whole thing. And except the unattached or the free gingiva, it is unattached to the alveolar bone, and it can move like freely. So that's why when we chew food, like some
Mhm.
food stuff, not cooked food and
Yeah.
stuff.
So what is the border?
And then the border
Is between the attached or unattached? Attached. The border is the junction between the attached gingiva and what? Yeah, between the attached gingiva and the cheeks and lips. You clear? Did you? Can you follow? Is it right? Did you? I just need to remember Jehyun. Do you understand, Jehyun? You may not understand, it's okay. But please ask, okay? For the whole class, not only for Jehyun. Okay, so that's the definition of the upper and or lower border of vestibulum oris is the mucogingival junction or mucogingival fold because it's like a fold. Okay? The junction between the attached mucosa and the movable mucosa. Do you agree that our cheek and our lips are the movable part of the mouth, while the gingiva is the not movable part? Right? Okay. Is there still any question? Clear? So that's the upper and the lower border, superior and inferior border of vestibulum oris. The anterior is the lips. The lateral is the cheek. The posterior is obviously the dental arches with their supporting tissues. Okay? Because as you can see there, the green one is the supporting tissues, right? The gingiva. Okay, that's the vestibulum oris. What is this? Is the other part? Can you mention all the star, mark, picture. What is it? That one on the right side. What is it? The one at the upper? What frenulum? You understand the meaning of labial, right? Labial is lips. Where is your lips? Yes, it's buccal frenulum because it's on the side.
Oh, yeah.
Oh, why oh? The name is following the position, the function, the shape. Okay? Labial frenum, if it is at the labial part, it connects the attached gingiva and the movable lips. That's why it's called labial frenulum. For the frenulum that connects the attached gingiva and the cheeks, the name is following the position. Buccal frenulum. There are upper and lower buccal frenulum, right and left buccal frenulum. For the labial frenulum, only two because it's in the midline, right? So it's only upper or lower labial frenulum. What is the other frenulum? There is one more. Lingual frenulum. It connects the floor of the mouth and the tongue. That's why it's called lingual, because it connects the lingua, our tongue, with the floor of the mouth. Okay? So if you are very good in terminology, it won't be that difficult. As I said many times, don't memorize everything. But I advise you to make your own dictionary. What dictionary have I told you to make? What dictionary?
Terminology.
What is it? You don't remember? No, you don't remember. Okay, so it's up to you. So I'm getting upset easily now. Okay? So, but do you think it is reasonable for me to be disappointed, to be upset? If you don't give proper response? Is it dear? No, thank you. Okay, so because you are not as what I expect, so I became upset easily. I tried not to be angry, but I think I cannot control the tone of my face. Not my face, the tone of my voice. Okay? I ask you to make your own anatomy, terminology, dictionary. If next time I ask you again and you still don't remember, so it's up to you. Okay? Because it won't be scored. I won't check. It's for yourself. You are the one who need to understand. You are the one who need to remember as much as you can. And by making by yourself the dictionary, it will help you to easier remember. Okay? Using your own words. Don't follow the definition words from the reference. It's quite often it's too long. It's using quite many new terminology maybe. So using your own way to describe whatever you need to remember or to understand. Okay? So, on the left side, do you know what it is? Yes, what is it? What's the name of this, that? All are gingiva. What's the difference? Which one is the attached? That?
Yeah.
This?
Yes.
No. So,
Bow.
this? Okay. And then what is it? What is the more specific?
Interdental.
Interdental gingiva. So the free gingiva is following the shape of the teeth. All these are the free. If you look at this picture, because you have this picture at the introduction slide in AMAS, right? Don't say no, because I know it is. It's there. If you look at them, if you need to use the magnifier, so use it. But I'm sure you don't need it because you're still young, all of you, okay? But you can see the border between the free and the attached gingiva. If we say free gingiva, or what is the other name for the free or unattached gingiva? There is one more name, marginal gingiva. Why? It's also called as marginal gingiva because it is at the which part is the end of the tooth? Yeah, it is at the end of the root. Yes.
Edge of the
What's the meaning of the margin?
margin means edge
Edge. Of the
of the tooth.
tooth is quite big.
Of the-
It has crown, it has neck, it has
Of
root,
the
it has
cervical.
apex. Yes, because it is covering all the margin of the crown. Okay? It's covering the margin of the crown. So it is called marginal gingiva. So marginal gingiva is also the free gingiva. Because marginal gingiva, as the name reflected, is only for the gingiva that is at the margin of the crown. Margin, bahasa Indonesianya tepi ya. Kasih tau jadi. Tepinya mahkota gigi. So the name is marginal gingiva. So as relevant to the two different parts of gingiva, the margin of the crown is the free gingiva. Okay? And then at this marginal gingiva, there is interdental gingiva. Do you know what's the meaning of interdental? Teeth. Yes, correct. Is it this class or regular class that at the last practicum session don't know the meaning of inter? Is it this class? No? Regular class? At that time I again upset. How can you don't know interdental? So I give an example. Do you know interaction? No. Then when I said, do you know international? Then they know. See, that's the skill of using Bahasa, right? I'm sure I have also taught in this class the advantage of being good in using Bahasa Indonesia and of course English. Because it's the same, right? Interaction, interaction, international, interdental. So if you know the meaning of inter, it won't be a problem for you to look for which part of gingiva is the interdental, right? I always want you to reduce the amount of material that you need to memorize. And you can do it if your skill in Bahasa is good. Both Bahasa Indonesia and English, of course. Okay, so interdental gingiva. What's the name or the terminology for the apex of the interdental gingiva? What's the other name for the interdental gingiva? The other name? You haven't done your group discussion up? Yes? Papilla gingiva. Okay? Papilla gingiva. It's already been asked, is it? I think. So, in the interdental gingiva, the other name is papilla gingiva. Okay? Especially the apical, the pointing part. Okay? The pointing part of the interdental gingiva is also called papilla gingiva. Something pointing. Okay? But the whole area in between two adjacent teeth is the interdental gingiva. The pointing part of the interdental gingiva is the papilla gingiva. This interdental gingiva, of course, also the free gingiva. Also part of marginal gingiva. But marginal gingiva includes both the interdental and the labial, the buccal, free gingiva. Okay? So the interdental gingiva is only in between two adjacent teeth. The papilla gingiva is the tip of the interdental gingiva. The marginal gingiva is all area that covering the edge of the teeth at the cervical area. Is that clear? That all are marginal gingiva, but again, based on their position, it has their specific name. Okay. And then what is it? Or this? Yes? Mucogingival fold. That's the border of vestibulum oris. Okay? So if you want it clearer, please you look at them in front of the mirror and then you move your lips forward, okay, downward, and then you can see the border because we can move the lips, but the attached gingiva will stay still there. Okay, so the junction between the movable and the attached mucosa is the mucogingival fold. Okay? Okay, now if we open the teeth, we separate the upper and the lower dentition, we can see the cavum oris proprium. It's the cavity all over that area. Okay? The cavity more posterior than the dental arches. So what is the anterior border of the cavum oris proprium? Yes? The anterior border of cavum oris proprium. The teeth and the supporting tissues. What is the lateral border of the cavum oris proprium? Cavum oris? Cavum oris. What is the lateral border of the cavum oris? The teeth as well, because our dental arch is like a U shape, right? It runs from left, front, and then to the left, front, right. Okay? So both anterior and lateral border of cavum oris proprium is the dental arch and its supporting tissue. What is the superior border of cavum oris proprium? The palate. Do you know two different areas of palate? Hard and soft. What is the Greek terminology for hard palate? I think at our first meeting I already mentioned we will learn in the Latin terminology. Palatum durum. And what is for the soft palate? Palatum motor. It's easier because we just say it as it is written like bahasa Indonesia, okay? So palatum durum, palatum motor, labia, lingua, it's just like bahasa Indonesia. We just pronounce what we read as like what we do in bahasa, okay? Okay, so what is the inferior border of cavum oris proprium? The tongue?
The
You agree?
floor of the
The floor of the mouth. Okay? Although the tongue is attached to the floor of the mouth, but the part that is more inferior is the floor of the mouth. Okay? And what is the posterior border of the cavum oris proprium? Yes? The isthmus falcium specifically because pharynx is quite long. It's like a pipe going from upper, middle, lower. Vertical pipes behind the nose, the oral cavity, and the larynx. So it's a pharynx. It's not part of the oral cavity, but the part that is still part of the oral cavity, but positioned at the very posterior side of the oral cavity is isthmus falcium. Can you mention the components of isthmus falcium? To arch, arcus. Arcus is the Latin terminology for arch. Arch is English. Arcus is in Greek. Yes? Arcus? No, not pterygo. You can see it. Do you know the posterior side, right? Arcus, palatoglossus, and palatopharyngeus. Okay, can you pointing at the picture? Which one is the palatoglossus and which one is the palatopharyngeus? You don't need to memorize it. Just look at the picture and then use your thought. Which one is more anterior, the tongue or the pharynx? So, what do you think? Which arch is the palatoglossus? The one on the front. The one on the back is palatopharyngeus. It's similar like the way we name the muscles, remember? In this case, it is following the two parts that is connected. Okay, so the palatoglossus means from palatum to glossus. Glossus means tongue. Palato means palatum. Palatopharyngeus means it runs from palatum to pharynx. So if you have this vision on your mind, how is the anatomy of our oral cavity and the topography of oral cavity to the adjacent organ, the nasal cavity, the pharynx, and then you will understand the pharynx is more posterior than the tongue. Okay? Actually, you know this from since your childhood because you're swallowing using your pharynx, right? Although it is helped by the tongue, of course. But can you masticate using your pharynx? No. Can you taste the food using your pharynx? No. So if you remember your daily activities, it is clear, right? The tongue is more anterior than the pharynx. So palatoglossus is this, and in the midline, it meets at, what is it? Uvula. So the palatoglossus is the arch, arcus palatoglossus is the arcus that connect the palatum and the tongue, and in the midline forms the uvula. And at the back, it's a similar arch, it's like gerbang, right? Palato, also from palatum, but to the pharynx. And what is placed in between these two arches? Huh? What is it?
Tonsil. Palatine tonsil. Palatine tonsil.
Tonsilla palatina. Do you know what is it? In bahasa Indonesia? Ya? Tonsilla palatina? Atau Genza udah gak nyebut ini lagi ya? Amandel. Masih nyebut amandel Genza? Kirain yang tua-tua aja. Oke, ada yang udah diambil? Does any of you have experience the operation to take out this amandel? Kata yang tua-tua sering ya. In the childhood, we get flu easily, right? So the doctor quite often advised to have tonsillodectomy, means cut out the tonsil. And we have several tonsils, but the amandel is the tonsilla palatina, the one that is blamed for being easily got through. Okay? Actually, it's not, because there are 3 kinds of tonsils. So, is there any questions? I think in every exam, I always ask about isthmus faucium. So, if you would need to ask me now. Don't wait until after the exam or the quiz. Is it clear? Yes, isthmus faucium. Arcus palatoglossus forming the uvula, and then tonsilla palatina in between the 2 arches, and the back arches is the arcus palatopharynx. Okay, now the tongue. Actually, the tongue could be divided into 3 parts. What do you call pangkal in English? Pangkal, what is it? Okay. So the bagian pangkal, the part that is attached to the floor of the mouth, is assumed as the pangkal, the beginning of the tongue. Okay? It is called as radix. Radix equal to root. Later, we will also call the tooth has root, right? Or radix. So the radix of the tongue is the part that is attached to the floor of the mouth. It is thought as the beginning of that organ. Okay? It's 1/3 posterior is the radix. And then the biggest part is called, what is it? body, corpus. We have learned about corpus sternum, right? In BBS, musculoskeletal system. So corpus mandibula, corpus sternum, okay? What else? Gaster also have corpus, right? It has pylorus, it has corpus. So corpus means the main part of an organ, badan. Okay? The main part, the major part is considered as the corpus. If cervix is a part that narrowing, smaller than the adjacent part, cervix, neck, corpus is the main, usually the biggest part of an organ. So the 2/3 anterior of the tongue is the corpus, but the tip, because of the shape, it has tip, right? Because this anterior end of the tongue is the smallest part, agree? So this part is also considered as the apex. Same as the root of the teeth. The end part of the root is also called apex. Same as heart. Remember, you already learned heart, okay? Cardiovascular system, already learned in BBS? Not yet? Not yet, because the regular class already had that. Okay, but you already learned about heart in high school, right? So you can imagine the shape. The basis is at the top, and then the smallest part in the inferior part. And the smallest part is also called as the apex of the heart. Correct? That's what you learn in high school, right? So now you have at your anatomical terminology. You know what corpus is, you know what apex is, you know what radix is. It's not only for tongue, it also applies for several other organs. But the meaning is similar. Okay? And then that's if we consider the tongue from the part from the posterior to anterior. But if we consider the tongue from the view, superior or inferior, then there is two terminals. Dorsum, I think I already mentioned this. Dorsum means, this is our dorsum, right? Punggung. Our back is the dorsum. So the punggung of the tongue is the superior surface. And conversely, the ventral surface is the inferior. So the part of organ that is called as dorsum, usually the part that is considered stronger. Okay? Our dorsum is considered stronger than our ventral, where we have the belly, the thorax, okay? Because this anterior part is the cavities where all the vital internal organs is located. Okay? We have the digestive organs, we have the cardiovascular organs on the front, and all are soft tissues, right? That's why they are considered very important but very vulnerable. So in that, I think the female never had a fight, right? But these three gentlemen, have you ever experienced fight your friends or your rivals, maybe? When you are in the SD, in the primary school? Maybe not in high school. Did you? Have you ever had fight? No? I want to ask if any of you had fight and then you like this. Or the boxer. Although you don't like boxing, like me, I don't like boxing, but in a fit of it, I have watched several times. Not the whole competition, of course, but if in my house the others turn on that, then I cannot not go past that TV, right? So, can you imagine the boxer? When they are boxing, does any of them like this? Give their belly and give their chest to be hit?
No.
They will this, okay?
Yeah.
They will like this, and they cover the chest with this. Good? Right? That's reflex. Because all of us are aware that his anterior part is weaker than our dorsum. Have you ever watched, what do you call it, coolie? In English? Huh? What workers? Construction workers or in market? Does any of them carry the rice or whatever that materials? If it is very heavy, they will carry it on the back, right? If it is only one bag of rice, but if it is heavier than that, and then ibu-ibu kuli pedagang sayur itu kan, ibu-ibu juga manggul kan, manggulnya di sini, kalau yang di bawah banyak, kalau sedikit saya juga bisa gitu, ya kan? That's because to be aware actually that our back is stronger and it doesn't need protection as serious as our anterior part of our body. So it is also applied for other organs in our body. So in the tongue, with the tongue, the stronger part is called dorsum. Do you agree that it is the dorsum linguae has thicker mucosa than the inferior facies of tongue? Don't you think? Belajar mikro kan? Prof. Lisa. You also, together with this macro anatomy, you also learn micro anatomy with Prof. Lisa, right? No?
Not yet.
Not yet?
Not yet because Professor is currently in China.
Yeah. But the material already been given, right?
I'm not sure.
No? For group discussion? The
For
questions?
questions, we're only given micro, not macro.
Really?
Yeah, in a month. So we only learned about the micro lab.
But you already asked about the mucosa.
I'm not sure for the other classes, but for
Because I got questions from B form and there are questions about mucosa type. So I thought,
oh yeah, we've already studied that one.
yeah, you already been asked, okay, to study about several types of mucosa, am I right? Oral mucosa. So, have you studied? Not yet? From your face, I can tell you haven't studied for that. Although you have been asked to answer that question. And all the information are there in the same book with the macro anatomy. Okay, so now forget about the reference that you haven't read. So just look at your friend's tongue. The dorsum and the inferior surface of the tongue. Which surface do you think is thicker? Huh? Yes? What's your name? The one that always helped me with the screen. Huh?
Ayasi.
Ayasi. Ayasi.
Ayasi.
Like Japanese name. Jahil. Saya tuh sebenarnya jahil sih. Cuma kalau kamu ngesulit nanti jadi marah. I like to have jokes with students to keep me stay young. Okay, Ayasi. I heard you mention, what is it, your answer? Dorsal sticker, it's correct. And why God makes our dorsum linguae is thicker than the inferior surface. I don't think this is on the book, so you need to think about this. We already discussed why our back is stronger than our belly, than our chest. Okay? So using the same way of thinking, can you try to answer why God created our dorsum linguae thicker than the inferior surface of our tongue?
Because it receives more friction.
Yes, from the, because it receives more friction from, friction from what?
From what enters our mouth. From the teeth.
Yeah. So what is the main function of our mouth? To masticate. Okay? So which part of tongue that is exposed to food material? Okay? So it's correct because it receives more friction from what? From external materials. Then every day we keep pushing it inside in our mouth. The more stress, the more you eat, right? No? That applies for me before I get fat. Now I try to control it. But I know many people doing like that, right? The more stress, the more you eat. Or maybe some of you, the more stress, the more you sleep. Everybody has their own way to diminish, to reduce the level of stress. Okay, so back to the tongue, because the dorsum linguae is the part that has contact more intensely both to any other part of the mouth, right? To the restoration that maybe we have in our teeth, to the sharp part of our teeth, maybe. Can you imagine when you try to clean the remains of the food that inserts in between the teeth? We use our tongue, right? Do you use it like this? Or, okay? So, we use the apex, but usually more on the dorsum surface. Because it has more risk to be irritated, right? So the dorsum linguae mucosa is thicker than the inferior surface. Okay? You can look at your own tongue in the toilet later. You compare when you this and you this. You can see that the inferior surface is thinner. It's that thin that it reflects the underlying vena on that surface. Okay? Is there any question? Do you want to ask any of this? The tonsil of the tongue, all are in the book, so you should know. You can open your book, right? Filiform, fungiform, circumfallate, and foliata, papillus. Okay, and there is a sulcus. Who doesn't understand yet how is the sulcus? This is the clear example of sulcus. Sulcus means a linear, long depression that runs on a particular surface. Because this one runs on the surface of the tongue, so it is called sulcus lingualis, and because the position is at the midline, so the name is sulcus lingualis media, or sulcus medialis linguae. It's okay. So the naming is very often like that. It informs us the position or the function or the part of other adjacent tissue that is connected by that structure. Okay? What is it? The rough surface at the radix ligmoid. What is it? Yes? Yes? Louder? Lingual tonsil. Tonsilla lingualis. So you can imagine the position of the two tonsils are very close one to another, right? Tonsilla lingualis on the dorsum surface of radix ligmoid. And then on right and left sides of isthmus falcium, which is the posterior border of oral cavity, are the tonsilla palatina. Only one more tonsil that you need to learn, that these three kinds of tonsil is very important in supporting our immune system, especially in screening the harmful material before it enters further into our respiration or digestive tract. Because it presents one on the tongue, secondly on the isthmus falcium, and thirdly on the pharynx. We will learn later on the larynx, pharynx topic. So, if before is dorsum, this is the inferior surface. Do you know what are they? You just read it. This is frenulum lingualis. Okay? The position and the length of frenulum lingualis will affect the way we pronounce R. What is channel in English? No English man channel? Some of them must be. Okay? Those that cannot pronounce R clearly. Okay? Maybe for Western people it doesn't matter because their language justru perlu not too hard, but for us, for Italiano maybe, or for it will be a big problem. So if the position is too anterior, can you imagine? The frenulum lingualis is the structure that connects the floor of the mouth with the radix ligmoid. What happens if the position of the attachment is too anterior? Does it affect the movement of the tongue? It will be more movable or less movable? Less. So now you know why some people is tired, right? Either it is too short or too long, the frenulum, or too anterior. Just imagine that we can move our tongue quite freely, right? We can do it in any direction. But what happens if the attachment is too anterior? You can imagine it, right? It's closer to the apex. Then the movement will be limited. Okay. Everything clear? You will learn about all this in the practicum, okay? But all are in the book. In letter. Did you use letter?
Yes.
You have letter, but you haven't opened it. Yeah? I do root. Okay. Tongue muscles. You cannot see this, but you need to learn about the muscles of the tongue. So basically, there are two groups of tongue muscles, extrinsic and intrinsic. The extrinsic muscles will support tongue movement to move anterior or posterior or lateral or upward or downward. Okay, that's extrinsic. So these extrinsic muscles will connect the tongue with other parts surrounding the tongue or surrounding the oral cavity. So the name like styloglossus, hyoglossus, the naming usually following the origin and the insertion. You still remember insertion is the fixed part or the movable part? Yes? The movable. For those who is not answering, please remember insertion is the movable part. And the naming usually from insertion to origo or from origo to insertion. Origo to insertion. That's why the name is hyoglossus. Do you know what hyo is? Osteoid. Because the movable part is the tongue, right? That's why the name is always the origin from osteoid, from processus styloideus, for example, the fixed part to the tongue. Styloglossus, hyoglossus, genioglossus. Okay? That's the extrinsic muscles. The intrinsic muscles is or are the muscles that form the tongue itself. So, does any of you sometimes eat beef tongue? No? Same as me, I like beef tongue. Maybe more younger generation eat healthier. It's gonna get that fatty meat, right? So if any of you ever eat the beef tongue, you can see the fibers, right? That forms the tongue. That's the intrinsic tongue. Why? We want to go?
Oh, I'm just like putting it so that it's one
He's being a security guy. Satpam. Tiba-tiba keren ya kalau bilang satpam. Keren juga. This. So it is named following the direction of the fibers. Transversal, longitudinal. Okay? Okay. Is there any question? The details open your method. Palatum. Palatum durum and palatum molar. Don't forget. Durum and molar. Durum is the hard part. 2/3 anterior part of the palatum is palatum durum. 1/3 of posterior part is the palatum molar. Do you know why it is hard? Why the palatum durum is hard? Yes? What do you think? Is the gingiva covering the alveolar vein? Then the mucosa of the palatum covering palatum bone. But the anterior part of the palatum covering what bone? You still remember your osteology? What part of bone that forming the palatum durum? Is it nasal bone? Is it frontal bone? Is it zygomatic bone? Yeah? Maxilla. Okay? Maxilla will be your lifelong business. If you're graduated as a dentist. Okay? So the part of the maxilla, some part of the maxilla goes posteriorly to form the palatum durum. And do you know what type of mucosa that covering the palatum durum? Is it keratinized or non-keratinized? Have you learned about that? You should see. Is it keratinized or not? Keratinized, right? covered by caratinos mucosa. Actually, it's one of your questions in the before. You know what? It's similar like tongue.
Why is it covered? Because it impacts your
Why it is keratinized? All part of your cavity is covered by the mucosa.
Yeah, it's resistant to infection.
Yeah. So it's to protect. Because when we are chewing, the palatum durum is the part of the palatum that receives force, receives pressure from the mastication movement and from the food itself. Don't you think? Later when you have your lunch, try. Okay? Try to chew without touching the palatum durum. Can you do that?
No.
That you can do chewing without touching your palatum durum. Yes, because it is touching and then we will do it. Understand? If we crush our palatum molar and then it will initiate our gag reflex. So we will, by reflex, just put the food in the anterior area. Okay? And then when the bolus is ready to be swallowed, then we will send them posteriorly, and then it's okay to touch the palatum because we need them to do the contraction to push the bolus backward and downward. Okay? Not upward. And then it will goes out through the nose. Okay? Nobody do that on purpose. Okay, palatum durum, and then you have to know what structure that are visible on palatum durum. There is linea, rugae, papilla incisiva. Do you know which one? As the name reflects, incisiva. So can you guess in what area? Yes, in the incisors area, behind the two central incisors. Okay? So it is at the midline. Papilla incisiva. And this is important, so that's why I also give you, where is that? Oh, the next picture. Okay, that's why I give you the picture of the bone, the skeleton of the palatum. This is the covered one, covered by the oral mucosa. This is the skeleton only, beneath this, of course. So I want to remind you these two important foramen. Okay, why? Because later, when you need to anesthetize the anterior teeth, anterior teeth, you can direct the needle to this foramen. And the clinical sign of this foramen is the papilla incisiva. And for posterior upper teeth, you may direct your needle toward this palatum foramen. Foramen, palatum major and minor. Actually, there are two on each side, the big one and the small one. So that's the access for the nervous, the branches of the superior alveolaris nervus. Okay, anterior is papilla incisiva, the cover of the foramen incisivum. The posterior one is around the posterior side of the second molar. And this is palatomastoid. I will be explained. You can check again the reference, and then salivary glands. So actually, do you think we only have these three salivary glands? salivary glands? Yes, all over the mucosa. Beneath all oral mucosa, palatum, buccals, lips, bottom of the mouth, everywhere. Okay? So all oral mucosa are covering the minor salivary glands. But because they are very little, it's abundant, so many, you don't need to memorize them. But and we know they are everywhere. So as long as there is mucosa and then beneath them must be present the minor salivary glands. And the ductus is very short, directly excrete the saliva on the mucosal surface above it. It doesn't go through any other structure, so I brought it to memorize it. The important thing is these three major salivary glands: parotis, submandibular, and sublingual. And because it is big, the ductus is also quite long, and it goes through some other structures. And it has openings in the cavity, the oral cavity, not exactly on top of the gland, because the gland is quite big. Okay? So that thing you need to. This is the ductus. You know the difference between the ductus and the opening, right? Ductus is the structure that brings out the saliva from the gland into the oral cavity. That's the ductus. It's like a tube. Okay? So it goes, start from the glands, and then it is ends in the oral cavity. So the opening, you should also know, that's also your practical task. You need to search for the opening of the ductus parotideus, ductus bartholini, and ductus bartholini. Okay? Okay, questions from B form. I print this red because I thought this is supposed to be for Professor because it's more about histology. That I share the principle quite somewhere. Right? But actually you should have learned about that. Although the manifestation is postponed, but the questions already been shared. Good? I will check the doctor. Okay. You said you haven't received the question list for the microscopic? You have or you have not? Huh? No. The question for your group discussion activity. The question that you need to answer in your PowerPoint, group PowerPoint. You didn't do any answer for the microscopic topic?
Oh, we have microscopic, but no macroscopic.
Oh, really? How come?
Yeah, we also do microscopic.
No macro? But some of the question is about macro. Don't you think? The borders, I read that. It's about macro. Right? The components in each of the area. It's about macro. Do you know the difference between the macro and the micro? Anything that is visible by eyes, by naked eyes, is macro. That's why I very often ask you to see yourself in front of the mirror. Because it's macro. You don't need microscope. You don't even need your glasses. Okay? That's macro. Clinical. Anything you can see on your patient. Microscopic is anything inside what we can see macroscopically. Cannot be seen without microscope, without dissecting the organs. You understand? You cannot see histological view if you look at the intact, the whole organs. You cannot see. You have to dissect very thinly. The tongue, the mucosa, whatever we need to see. And then we need help from the microscope. So there are two different things. First, the organ or the tissue needs to be dissected, not more than 5 micron. And secondly, we cannot see it only by our naked eyes. That is histological. Anything that we can see in our mouth, or when we only dissect the skin when we are learning muscles, but we can see it by our naked eyes, it's anatomy, it's macroscopic. Okay? Okay. Is it clear the difference between keratinized and non-keratinized? You can see the upper picture has keratin layer. Keratin layer is a layer without living cells. Why? Because any tissue that has cells will not be that strong. Okay? Because for cells to be able to live, they still need organic material to receive nutrition, oxygen, to do communication with other tissues so they can still live. So the tissue will a bit weak. But the tissue that doesn't have cell could be very strong because it will not need organic material or need but only in very little portion. Okay? So keratin layer is a layer on the very top, on the very external, that doesn't contain any cells. So it's tissue, and that's why the beneath epithelial tissue could be protected very well. That means this keratin only present on the part of oral cavity that receive more force, more pressure, or mastication mucosa. The other part of oral cavity that still require movement will not have keratin layer, because with the keratin layer on top, it will limit the movement. It will limit the flexibility. So like tongue, lips, cheek, it doesn't have keratin layer because we need them to move freely, okay? Almost freely. Is that answering the question? The picture, you can search them by yourself. There are many versions of pictures. What happens when the odontoblasts in the dentin are killed? Who killed them? Okay. Scary. Killed. So who's the murderer? If you use killed, it's like there is a murderer. Okay, so any question like this, actually you can think of the answer by yourself. Just go back to the role of that cell. Any cell you want to ask similar like this question. Just check for the role of the cells. So you can answer questions. Can you? Odontoblast. Odonto, what tissue is connected to the cells? Have you learned odontology? You say that yet, I will tell you Dentin. Okay. So what's the role of odontoblast? You know osteoblast, ameloblast, odontoblast. What's the difference? Yeah. Odontoblast produce dentin. Ameloblast produce enamel. Osteoblast produce bones. So you can answer that. Their main role is to produce tissue. So you can answer it. What happens if they are killed? What happens? What is disturbed? The formation of dentin. You can answer it by yourself. And on top of that, odontoblast also has role in transferring the sensation to the nerve tissue because of their location, which at the border of the pulp cavity. And odontoblast has a part that is called processus. Processus means tail because the shape is similar to a tail. And this processus goes in through the dentinal tubule. Have you learned about that? Not yet? I will check with Dr. Eric. Have you learned about that? No? Okay, so firstly, the production or the formation of dentin will be disturbed. Secondly, the transferring of sensation will be disturbed. Thirdly, odontoblasts also help the immune system of the teeth. Okay, so you just check the role of odontoblast and then you can answer yourself. Okay. If the cementum break the same, can you answer this now? I already give you direction how to answer such question. You just check the role of the cementum. But can you answer it now before checking? Do you know where is the position of the cementum? Yeah, attach the root of the tooth to periodontum. So what happens if the cementum is damaged, not killed? Because it is a tissue, not a cell. What will be bothered? The protection or the attachment? Or both? Both. So you like to choose, but you don't like to answer it straightly. You do? Okay, so you just check the role of the cementum. Of course, it's similar as enamel. Enamel protects the dentin and the pulp. Cementum protects the dentin on the root part, and of course the pulp chamber and root canal. Okay, so if the cementum is damaged, the protection role will be disturbed, and then the attachment role will be disturbed. The consequences of disturbances of tooth attachment is the tooth will, yeah, will. Can you move your teeth now, please? Can you? No. Why do you think it cannot be moved? Because it's healthy, it's normal. And how is the healthy teeth? It has a proper attachment to the periodontal tissues. And who's attaching them? ligament and the cementum. So the bonding, the attachment is between the periodontal ligament and the cementum. So if this cementum is damaged, the fixation of the teeth will be disturbed. Starts from has movable action, so it's not. So from 1 degree, 2 degree, 3 degree, and then the severe one, it can exfoliate by inside without being extracted. Okay? Does smoking affect the duct epithelium? What do you think? I'm sure you can answer yes or no. What you don't know is why. Is it? Of course, because smoking, the process itself produces heat, right? The heat will irritate the tissue. And then the content of the smoke itself, so many harmful material. The nicotine, the tar, and so on. Okay, so all will cause vasoconstriction. Can you imagine what happens if there is a vasoconstriction? What is the role of the vascularization? Yeah, so for what? Blood. Of course, vascularization brings blood, but what is the importance of blood? Oxygen, nutrition, okay? So the blood brings in and brings out what the tissue needs and brings out the waste product. Okay? So if there is vasoconstriction, this process will be disturbed. The tissue will suffer insufficiency of important things that they need to stay healthy. Okay? Okay. What else? If your teeth are brittle, which part is I don't understand this question. What's the meaning of this question? Do you know why this is it the whole tooth is brittle or what tissue of the tooth? Because nobody explained what's the meaning of the question. What's the meaning of the question? Rita. The one who asked this should be able to explain what they want to ask actually. The whole tooth is brittle or one or two particular tissue of the tooth brittle, and what's the meaning of brittle?
It's like some people, maybe like you can see it on the top, they didn't brush their teeth for like almost a year and stuff because their teeth is too brittle or too like too fragile. Yeah, fragile. So like when you brush their teeth, it's like sometimes the teeth got ugly or maybe like chipped out or something.
Okay. You will learn about this actually next year in the third semester. You will learn many kinds of disease or anomalies of the dentition. But actually, if the question is from experience or from stories from some people that they don't brush their teeth for a very long period and then they feel like there are some rontokan, what is in English rontokan? There are some part of the tooth that are pushed. Actually, I can tell you that it's not the part of the tooth, it's the calculus. Can you imagine if we don't brush our teeth for a very long period of time, and then the formation of calculus will be very severe. That's one possibility. Because the calculus is not part of the dental tissue, it's a mineralized plaque. You know plaque, right? From the Yeah, the excess food that stay on the surface of the teeth for a long time, and then by the time it will mineralize, become hard and attached to the surface of the tooth. So sometimes it can break by brushing or by biting something hard. Okay? That's one possibility. The second possibility, the tooth has already decayed, has caries. So in this situation, some part of the enamel will be easily dropped. But you don't learn about this yet. This is just a spill of some clinical cases. Okay? Okay then, and